This segment of Bridge Street is sponsored by St. Joseph's Health Cardiovascular Institute.
Well, here's something you may not have known. During the final months of the year, during the holiday season in particular, the number of people suffering from congestive heart failure increases dramatically.
And joining us to talk more about this scary trend, Dr. Russell Silverman, Chief of Cardiology at St. Joseph's Health, and Andrea Atchison with the Heart Health Academy.
Good morning.
Good morning.
Thank you so much for joining us.
Thanks for having us as usual.
And Dr. Silverman, we'll start with you because Thanksgiving is coming up in 3 weeks from now, and you're saying that during the holidays, this is the time when the emergency rooms are full of people coming in from that, congestive heart failure.
That and a lot of other holiday-related illnesses. Andrea will talk about it as well, but certainly we face a lot of a great influx in patients coming to the hospital, not only because of the cold weather and maybe the flu or whatever else is going around. Right. Get your flu vaccine, by the way. But also overindulgence in foods, alcohol, high sodium containing foods, particularly for those patients in congestive heart failure, which always throws them over the edge. And Andrea will talk about some of the symptoms to watch for, but these are the things that people have to be concerned with when eating holiday-related foods, which are so delicious but so salt-laden.
And that's the problem there, Andrea, right, is the sodium.
And adding the salt, extra salt on top.
Absolutely. So when you have a diagnosis of heart failure, which over 6 million people in America have, you run into the problem of eating too much sodium or salt for the holidays. And I know I love to eat in the holidays. A lot of us eat a lot of extra food. And the problem is there's a lot of hidden salt in some of the items that we're eating. And that can tip you over, like Doctor said, into what's called an acute heart failure episode, where you have to go to the emergency room because you're retaining fluid in your legs, which is called edema. It also can back up into your lungs and cause severe shortness of breath. And so you just don't feel well and you need to go to the hospital.
Right. So this is not necessarily like a heart attack. Congestive heart failure isn't.
Correct. So heart failure is a chronic condition of the heart where the heart muscle is not pumping very well, and so you're not getting your organs perfused. And it can be from a lot of different causes. And so people run into a lot of trouble with this very chronic healthcare condition. Costs a lot of money with people going in and out of the hospital. They kind of bounce in and bounce out. And after the holidays, Thanksgiving, Christmas, New Year's, and even Super Bowl Sunday, so you got to think about that.
It just keeps going.
It's just different foods that are out there, and we're overindulging, like Doctor said.
Just the opposite of the holiday cheer, right?
Exactly.
It's your health most important. If you don't have your health, you have nothing.
Right.
Well,
So what should you do?
You need to moderate, which is really the best way to treat most health-related issues that may be due to dietary indiscretion, but moderation of what you eat, moderation of what you drink, alcohol in particular, which not only causes the foods that are high in sodium not only cause the heart failure issue, but the alcohol also aggravates heart rhythm problems, which then lead to congestive heart failure. Usually this is not a heart attack situation, but it can either lead to that or be caused by it. But congestive heart failure on a recurring chronic basis is aggravated during the next 2 to 3 months.
Okay, so then what are some of the symptoms then that we need to watch out for?
So you want to look for not only symptoms, but changes in symptoms that you may already have. So if you have fluid buildup in your legs, if you're short of breath, you may be fatigued, you may be dizzy, you could even get chest pain. There's so many things to watch out for, and look for a change in those symptoms. Some chronic heart failure patients have a baseline excuse me, of shortness of breath, but if you're noticing that it's worsening for some reason, and also know your weight. So know your weight all the time, not just around the holidays, because if you gain like 3 or 4 pounds, that could be a sign that you're retaining fluid.
Okay.
And it's extra stress then, of course, probably on the heart.
Sure.
Extra weight.
So weight gain really is a key, as Andrea mentioned, and most people will weigh themselves in the morning, and if you're seeing a 2 or 3 pound weight gain over a day or two, or a 5 pound weight gain over a week, you should really call your provider to get some guidance as to how best to deal with that. St. Joseph's Health, we have a team of nurses that actually go into patients' homes who have heart failure, and we measure their weight and we monitor them remotely. We have a remote monitoring program for a lot of our patients. So we try very hard to keep patients out of congestive heart failure, out of the hospital for readmission. because when you're in the hospital, you're not just being there treated for your heart failure, but you can acquire other illnesses, and so it's really very important to keep people out of the hospital if possible.
Listen, we want you to stay out of the hospital. So Andrea Atchison is a physician's assistant, wellness coach, and chef. If you would like her to help you, or for more information, you can visit thehearthealthacademy.com.